Hello, I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. Our guest is Anna Sundgren. She's Renal Disease Strategy Leader and Global Medicines Development at AstraZeneca. And she's joining us on Health Professional Radio today to discuss what's on the horizon for chronic kidney disease patients, or CKD patients, and the physicians that take care of them. We've seen very little innovation, apparently, in the last 3 decades or so, and Dr. Sundgren is going to give us a little insight into what we can expect in the coming years. Thanks for joining us on the program today, Dr. Sundgren.
Thank you so much for having me.
Renal Disease Strategy Leader at AstraZeneca. It's quite a mouthful, and I'm sure you've got quite a responsibility there. Give us a bit of your background, and let's talk about what you do there at AstraZeneca.
It is a mouthful, Neil. Yeah. I've been working with AstraZeneca for a very long time, actually, and I've always been very interested in renal disease. I'm a PhD by training, and my mom actually passed away while on dialysis, and it's been driving my purpose in this for a long time. So for 5 years, I've been really committed to making sure that whatever we do with our drugs can also benefit renal patients, which is an area that's seen very little innovation in the past 30 years, I would say.
How many people would you say are affected by renal disease, chronic kidney disease, on a worldwide basis?
Yeah, it's about 1 in 10, which is remarkable, actually, when you think about it. It's a disease that's not really well known. It's insidious in its nature, and it's really sort of a silent killer because you're not really aware of that you are sick until you're really sick. And 1 in 10 is a big number.
But what types of symptoms are we talking about that are so, I guess, subtle or non-alarming that we could be sick and not know it?
That's a very good question. So the kidney is a vital organ for us. It clears toxins out of the body and clears water out of the body. And when you're born with a certain number of units, which are called filtering units or nephrons. And you don't get any new ones. You're born with the ones you're going to get, essentially. And over time, you lose them, and it's a normal process. So over time, with age, you lose them, these filtering units. But when you are seeing accelerated disease drivers, and these could be high sugar or high blood pressure or ongoing inflammation, these filtering units, you lose them faster over time. And it's not apparent to you as a person that your filtering capacity goes down until it's really bad. And then you start seeing complications because of your inability to clear yourself from water and toxins and ions.
Is there a method by which we can monitor our kidney functions, say in our teens, then again a few decades later, to kind of keep a watch on our kidney function, or there's no preventing it? Does monitoring it give us an opportunity?
Yeah, no, absolutely. You can monitor it. So there's primarily so you can measure protein in filtering capacity with a function which is called glomerular filtration rate, which is calculated on your BMI, your body weight, and a marker called creatinine. But what's interesting is that normally in clinical practice, we don't really do it very well. And if you are a person with a high risk, such as you're having diabetes or hypertension, or even if you have kidney disease in your family, it's really important that you do monitor it. And not everybody does that. So therefore, when the kidney function dramatically has gone down over several years, that's when you're starting to see these complications, and then you approach your physician. And then at that time, it's late, and your kidney function is very difficult to restore.
Having been involved for many, many years in renal functions, why, in your opinion, do you think that the medical field hasn't accelerated its, I guess, a sense of urgency? I mean, 1 in 10 worldwide, that must be at least comparable here in the United States. Why do you think it is that the medical community isn't jumping on board with more tenacity as far as kidney function is concerned?
Yeah, that's a very good question. And I think the first reason I think there is that when we do clinical trials for any type of disease, when you select patients for those trials, you want to make sure that you select patients that are the right ones. And people with declined kidney functions are often excluded from such trials because they are frail, and we don't want to induce any problems for them with exploratory drugs. And so very often these patients are sort of excluded, which means that very, very few trials are actually done in renal disease patients. And that is one of the reasons. So we wouldn't have found serendipitously by sort of by just sort of finding it by coincidence, we wouldn't have found new drugs because we've excluded the patients in our trials. And then when it comes to actual sort of dedicated drug development, you really have to focus on these patients in order to find the scientific mechanisms that make sense. And unfortunately, there's been few companies that have done that. And so we are very proud in AstraZeneca to come from a heritage where we have done a lot of cardiovascular development. We have a big portfolio in diabetes, and we're also very interested in inflammation, and I've worked in inflammation and respiratory for a long time. And since those three are the primary drivers together, the primary drivers for renal disease, it made a lot of sense for us to put a stake in the ground and really move into development for renal disease patients. And I'm very proud that this year we are going to be able to launch 2 new medications globally, not in the US, but two new medications, one in the US and one in another country, that are actually targeting these patients. And it's actually a very big step for this community where it's been very quiet for several years.
What would you say is on the horizon? I mean, 1 in 10 cases. Do you think that we can bring that down to maybe 1 in 8 over the next 20 years?
That is absolutely my vision. I'm hoping that we can see a world ahead of us, not too far away, where people living with CKD are able to live much longer. And really, when they get the diagnosis, it's not a death sentence. So we want to really be able to help manage the complications that are life-threatening and also stop the progression. And so a visionary future for us would be that there would be less need for dialysis centers, and also that there would be a better supply-demand match for transplants, because if we can halt these people progressing in their disease and also manage how they die essentially, because there's a lot of people succumbing to cardiovascular death in this area. And if we can manage that, both complications and disease progression, then we do believe that we can move from CKD being a death sentence for you to something that's much more positive in just over a few years.
Where can we go online and get some more information as listeners about AstraZeneca and the developments that you're working on to combat CKD?
So the best place is to go to our website. It's www.astrazeneca.com, and we have a very interesting view there of our renal portfolio that you can have a look at.
Dr. Sundgren, thank you so much for joining us here on Health Professional Radio.
Thank you, Neil. It was a delight to talk to you.
Yes, you as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Anna Sundgren, Renal Disease Strategy Leader, Global Medicines Development at AstraZeneca. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.